Hi, myself Dr. Apurva Sahu and I am an orthodontist, a braces and a aligner specialist. In this video, I want to talk about the instructions what we give to our patients after we start the braces treatment. So when we start the braces treatment, there are set of instructions what we like to give to our patients so that it becomes easy for them to handle that braces so that there is no pain, no discomfort and especially there is no breakages. So let's start with the video. The first most important thing is brushing. You have to brush 2 times with your normal brush when you have braces. This holds true for everyone who don't have braces also, but with braces, nighttime brushing is mandatory. And especially whenever you are having anything, you can rinse in afternoon time or evening time, but morning and evening 2 times brushing is compulsory. There are different types of brushes available in the market which help you to brush easily. One of them are basically these brushes which have the central groove cut in between so that you can that can fit between your braces very easily and you can brush with them in ease. These brushes you don't have to put in any angle per se. You can directly straightforwardly put it in horizontal position and clean because the central groove is cut in between. But if you don't have these brush, no need to worry. With normal brush also you can brush very easily, but we have to just make sure that the angle is correct because the brackets are placed like this. So you just want to angle your brush not like parallel to this, but in an angle, 45-degree angle, so that you can clean the upper part of the teeth and the lower part of the teeth from the braces. Lower part of the braces and the upper part of the braces. You have to divide your teeth into 6 quadrants: upper right, center, upper left, lower right, center, lower left. And you have to make sure that you give at least 30 seconds every time you're brushing. So just make sure that you're brushing on the upper part of the braces, lower part of the braces, upper part of the braces and lower part of the braces. So this should be the basic pattern when you're brushing with your brush and paste. There's one more brush available in the market which is an interdental brush. I think this is one of the most important brush when you have braces on your teeth. This brush basically helps to remove any debris or any food particles stuck in between your two teeth. So when you are using this brush, make sure that this goes between the two brackets and the wire and you can clean this like this. I recommend to use this brush at least once a day. Once a day in the time, especially when at the night time, when you are going to brush with your proper brush and paste. Before that, you should use this brush and make sure that every food particle which is stuck between your bracket and this get loosened up. This brush helps to loosen up the food particles, and then whatever food particles are stuck, you can always remove this with them. This is for your teeth. What about the gums? For gums, I feel the best mouthwash available in the whole world is warm water, salt, and turmeric. Half glass of warm water, a teaspoon, half teaspoon of salt, and a pinch of turmeric. Just boil it, let it become lukewarm, and then you can rinse with that. So that helps to keep your gums proper. This technique can be used for everyone, from child to adult. Everyone can use this without braces also, because this helps to keep your gums healthy. As we all know, turmeric is a natural antiseptic, and warm water with salt gives a soothing effect to your gums. So this combination is, I think, one of the best mouthwashes available with no side effects. If you have blood pressure, you can definitely reduce the amount of salt in it, but we're not going to intake it, so it's fine. The second most important point what we want to talk about is the food restrictions. I know that this is one of the most irritating thing for a child or an adult, but food restrictions are the most important ones. You can have all your home food, dal, rice, chapati, vegetables, all are fine. But anything which is hard, especially bhakarwadi, chakli, kurkure, popcorn, eclair, 5 star, chicky. All this sticky food and hard food are a big no-no. You can have poha, but you cannot have the groundnut bread. If you have a habit of having soaked almonds or cashew nuts and all these things, you can definitely have that. But tell your parents or tell your mom to just grind it in the mixer, make it in the powder form, and you can have it with a spoon. We need the nutrition of the almonds and the cashew nuts. We don't need to chew it. So food restrictions also include, if you are especially a non-vegetarian, you can have all your non-veg food also, but make sure that it is a boneless. You don't need to chew the bone, just remove the bone and take the soft pieces. That is fine for us. Eggs are still fine, pastries are fine, but pastries are a little sticky, but you can always rinse and clean your teeth with the brush, and then that can be fine. The third factor which we tell our patients is about the pain factor. Is it going to pain? Yes, it is going to pain, but the perception of pain is different for each individual. The pain will never be throbbing pain, you're not able to chew your food or your headache is very severe, but it is going to be a sweet pain because something new is happening. So your body is going to convert, or your brain is going to convert that pressure on your teeth into pain by the pain pathway, and there will be pain. So that's a mechanism by the body to tell you that something different is happening. Your teeth are moving. But after a week or so, when the pressure reduces, the pain definitely goes down. We recommend not to take painkillers because that comes in between your tooth movement. But if it is unbearable, you can definitely take a painkiller prescribed by an orthodontist. The fourth factor, what we talk always to our patients, is about if something is poking. Friends, if it is paining, you can bear it. But if anything is poking you, try not to bear it and come to the office as soon as possible. That poking will convert into an ulcer, and that ulcer will always give you irritation. So in braces, this pokiness and ulceration is more irritating as compared to the pain part of it. So if anything is poking, make sure that you come to and visit your orthodontist so that they can remove that extra wire which is poking from the back or any part of the bracket which is there. There is something known as ortho relief wax which you can get it from your orthodontist. You can use that ortho wax to put that on the particular part where it is poking so that that pokiness can be stopped for time being till you visit the orthodontist.